Hi everyone, my name is Dinesh Sirisena and I'm a consultant in sports medicine. I use ultrasound regularly in my clinical practice and I'm going to be sharing with you some of the tips I've learned along the way so that you can apply it in your clinical practice as well. Today we're going to be talking about ultrasound-guided interventions and the types that are available typically to us. So here's some of the interventions that I undertake in clinical practice. I've laid out the equipment and some of the medications just to show you the range of things. And now let's have a look at it in a little bit more detail. The bread and butter is the steroid injection. In the clinic, I use two types of steroid. Triamcinolone, which is 40 milligrams in 1 ml, or dexamethasone, which is 4 milligrams in 1 ml. The former I tend to use for general injections, such as the shoulder or the knee, and the latter I tend to use in spine injections, such as for the nerve or facet joints. The primary use of these is for rapid analgesia, as well as an anti-inflammatory effect. The next type of intervention that is commonly used is the hyaluronic acid. There's various preparations for hyaluronic acid and various strengths. Some require multiple injections, whereas others are a one-off and these are repeated every 8 to 12 months. The type and method of delivery will depend on what's available in your region, but these are typically used for degenerative diseases. As with the HA injections, the PRP has various collection methods available, and these will produce different yields of PRP. Here in the picture is the Regen kit, which is commonly used in Singapore, and there is an additional type which comes with hyaluronic acid already embedded within it. In Singapore, it's approved for tendon pathologies, although there is increasing evidence that it can be used for degenerative diseases as well. Moving on, we have Prolotherapy. Again, there's various different types of Prolotherapy available, either dextrose or phenol containing, and some even growth hormone containing. The purpose of Prolotherapy is to stimulate healing. In my clinical practice, I tend to use it for ligaments, but some authors also recommend that this can be used for tendons. Another type of injection is high volume injections. This is where a large volume of local anesthetic or saline is added to another type of injection, such as steroid. Situations where I use the high volume effect is in tendon stripping, hydrodilatations, and in situations where there's adhesions in the tissue. The aim is to release these adhesions or to expand a particular area, to strip the neurovascularity or to allow the area to move and glide more freely. Here is a summary slide of the purpose, the typical onset, duration, and post-injection advice that you might give for the different types of intervention that I have mentioned. I hope you enjoyed the video and it adds to your knowledge of ultrasound imaging and how this can be used in your clinical practice. If you did, please remember to hit the like down below and please subscribe to the channel for further updates. I hope to see you all in the near future with the next video. Thank you for listening.